Um, I'm seeing many known faces and also new faces or new names, which is also good. But yes, welcome everyone to this session. This is the second session of the series focusing on children and torture. And this one today we will be discussing best practices in treating children as primary or secondary survivors of torture. It doesn't come with in a better time. We're speaking now with Eugenia, Jane, and Joel, the presenters, the conflict in Palestine and the many children that are being exposed to trauma right now. But we will be unfolding all of this again with these three presenters. Joel Webe, she's a licensed clinical psychologist and child team coordinator at Restart Center in Lebanon. And then we also have Eugenia Mpande and Jane Mashonyika, correct me if I say it wrong, from Tree of Life, Zimbabwe. So we will start first with Joel. You can go.
Good morning. Yes, good morning, everyone. First, I would like to thank you for this invitation to take part in this webinar. Especially, it's coincide with what's happening around us in Lebanon and Palestine, and with the torture that we're seeing, and what children are suffering at present. And unfortunately, they are still suffering from all the torture around the world. And it's very aligned. I can say it's maybe unfortunate to talk about this, but maybe we can look at it from a different perspective, because we're talking about how to heal children and what are the best practices for children. So thank you again for inviting us. I will be talking about Restart experience and working with children, victims of torture, as primary or secondary victims of torture. I would like just to know that Restart has more than 25 years of experience in working with children and with families who are victims of torture. So during my presentation, I will be focusing more on what are the best practices for children. I will start sharing my screen. So let me check. Is it clear for everyone?
Yes, now it's perfect.
Okay. So as an outline, I will start with a brief introduction. What are the presenting symptoms that we see in the children? The practices, what are the benefits from our experience and our work for many, many years with children victims of torture? What are the challenges? And we'll have like around 5 minutes for questions and answers. So, okay. So I wanted to start first with the presenting symptoms. Why I'm starting with this? Because symptoms of trauma and torture in children are quite different from what we observe in adults, and are different as well depending on the age of children. So the symptoms are very different from infant toddlers to school-age children and to teenagers. So very briefly, if we're talking about the presenting symptoms, because these are the main complaint when family come to ask or to require services, they will talk about their children's symptoms. So the main symptoms that we see and we observe and are also noted in research in infant and toddlers are the losing progress on developmental milestones. And I will be going back to this later on during the presentation. Children will start acting out with bad behaviors. Most of the time, it would be an aggressive behavior, and it will be a new behavior that the parents are observing. They will have changes in eating and sleeping pattern. They may become very energetic. Sometimes they will complain about hyperactivity. They will be scared of new things. They will become clingy or afraid to separate from caregivers. Most of the time, we can talk about separation anxiety. The children will start showing some intense tantrums and more frequent tantrums. They will lose interest in play. They will act out the scary events through playing. They will cry a lot, and they will talk a lot about their nightmares. If we move to the presenting symptoms at school-age children, there are similar symptoms as toddlers, but what we find different for school-age children are the trouble concentrating. Especially, we have some complaints from school and from parents related to the learning process. Also, children at school age, they will show some physical reaction. They will complain of stomachache, headache, palpitation, breathing, very somatic, very unusual somatic complaints. They will start worrying a lot about loved ones. And one very, very important thing we see and we observe in children is that they start thinking they did something wrong or are somehow to blame for what is happening. And this is very crucial when we are working with children. Children will be fearful, as well fearful, and will have nightmares. As for the teenagers will show some risky behaviors, and usually they will complain from this, or their parents will come complaining of like behaviors, sexual, risky behavior, or hurting themselves. They have trouble concentrating. They will withdraw from loved ones. They will worry a lot about loved ones or the future. And one very important feature is they will think about revenge. And the second one, the teenager will start thinking about the world differently. They have a different and a shift in their perspective of the world. I wanted to talk about the presenting symptoms because this is really important to assess during the interview with a child or with the caregiver. So our intervention at Restart starts with an assessment. The social worker is the first person to meet with the family or the child. And she will be taking all, or he will be taking all the information related to the demographic situation, to the social situation, to the economic situation, a lot of information related to their social situation now and what is the main reason for their complaint. So after the social worker interview, the child is referred to a psychological assessment. When the child is referred to a psychological assessment, the assessment is done with a licensed and a focal point psychologist, and it will be an exhaustive assessment where the psychologist will ask a lot of a question, will observe the child, but the psychologist can meet in 3 different ways with the child. So depend on the age of the child. Psychologist may meet with the child alone. If he's like a school age, above 6, 7 years old, or if he is a teenager, the psychologist may meet with the child and the caregiver together during the session, or for like 1 hour with this child and another hour with the caregiver. So it all depends on the child age and on the child acceptance or will to be alone with the psychologist, or if the child prefers to be interviewed with the parents. So up in the psychological assessment, where the psychologist will use tools to assess the needs and the psychological symptoms, the psychologist will refer the child to the needed services. So this interview is crucial to identify the needs of the child and also to refer to the modalities that are the best for the child. So I will talk more about the modalities in the coming slides. So as I said before, very briefly, the interview frame is very different: child alone, caregiver alone, or child and caregiver. So after referring the child to the psychologist and after referring him to a psychological treatment, what we found is very crucial and essential, and we built on during our treatment, is the therapeutic frame and the relationship that we create with the child. It's very important to work on building a safe space with the child. This will enable the progress of the therapy and the progress of the child. So when we talk about a therapeutic frame, we have several golden rules for intervention and several factors that will contribute to create this space. The first golden rule is a confidentiality. It's very important and it's mandatory to be explaining the confidentiality for the child. Even if the child is very young, we explain the limits of the confidentiality, and we explain it very clearly, and we explain what are also the when do we breach the confidentiality. And usually, as we all know, the confidentiality is breached when we have a risk of self-harm or homicide. So it's very important to tell the child that what he says and what he expresses will be very confidential. And even if we're meeting with the caregiver, this doesn't mean that we will be talking about what he's saying during the session. The second factor is building trust. And building trust is not just a factor, it's a progress, it's a process. So we work in the first session and during all the session to build trust with the child, because the relationship that we have during the therapeutic work is very essential for the child progress. Empathy is also one of the golden rules. We express empathy and we empathize at every second with the child history and with the child suffering. We convey respect in everything, in the setting, in the body language, and how we listen, how we ask, how we normalize, and how also we convey respect when we give the child the time to express what he wants. Maybe he doesn't want to talk the first session. Maybe he just wants to play. We just follow the rhythm of the child. We're not asking him to follow our rhythm. We will go where it stands, and we will slowly bring the child to the progress or where we are standing. So it's very important to respect the vulnerability, the child capacity, to take time and to use several when working with children. So this is what is different from working with adults. When we work with adults, we may sit and just have a discussion as questions. When we are with children, we need to play, we need to draw, we need to see books, we need to do physical activities. These are all tools that we use to have a conversation and to build this relationship of trust with the child. What is very important as well during our first interview and during all the session is creating hope. And what we mean by creating hope with the child is just being attentive to what he's saying, validating, acknowledging his feelings, his suffering, and giving him hope that also some other children have passed through several experience, and with therapy and with support and with what we are suggesting at the center, and he will be able to overcome his trauma as many other children overcame their trauma. So it's very important to create this hope and to tell the child that we work with other children, we have techniques, and we will go step by step with him. And by the end, many children around the world were really overcame their trauma, and he can be one of these children. So it's very important to note this during the first and during the rest of the session. We also need to monitor the safety each and every time. It's very important to make sure that the child is safe, if we mean physically and emotionally and psychologically. So it's very important to ask about his thoughts about hurting himself, and if he's safe in the environment, if he's abused, if he's suffering from any violence, because this will help us to also refer the child to other services or other protection offices. And one last thing that it's very important from our experience, and what is really different here as well between child and adult, is that we work on restoring the child-parent relationship. As I said during the presenting symptoms, the child will start worrying about his loved ones, will start feeling that his parents, they don't understand what he's going through, especially if he's isolated, if he's not communicating as usual, he's exhibiting some aggressive behavior. So the relationship between the parents and the child would be very tense, because the parents are suffering as well, especially if they are victim of torture. Parents, they don't know how to deal with these problems, and because everything is new for them. So the relationship is tense, and there are conflicts between the parents and the child. So this is a very important objective that we work on as well during our sessions. So As I said, the modalities and therapies applied are very different. And this depends on the child needs and on the possibilities at the center. So since I'm talking about Restart, we use several modalities. We use individual sessions where the child will be with a psychologist alone or with a caregiver. And we work most of the time with the caregivers. Even if they are not in the session with the child, they will be having their own session for raising awareness, for psychoeducation about child symptoms, and for parenting skills, because they are the main people who can help their child. We may see the child once per week, twice per week, but the caregiver is with the child every day and every minute. Another modality is the family therapy, and this is really very specific and to our center. The family therapy is where many family members are followed at the center. So they will meet up with the psychologist. Each member will be supported by his psychologist, and we will meet up. And this moment is very crucial and very emotional, because it makes that every member meet in a safe place, and they know they have people to support them, and they will share their challenges, their worries, their nice moment together. We have another modality, group therapy, and the community-based services. These two modalities are very, very important as well, especially because they enable us to target a very big number of children. And we know that we want to serve as much people as we can and the best practices that we can. So group therapy session and community-based services are done on weekly basis, but we want to make sure that when we are using these modalities, the child is safe, he is in a safe environment, and he can be receiving these treatments. Community-based services are usually conducted in the community. So the psychologist and the facilitator, they have a co-facilitator who may be another psychologist, or who may be a person from the community, an outreach person who will know the people in the community, who will be supporting and helping, facilitating the session with the psychologist. Okay, so these are some photos of the individual therapy session. As you see here, the child, the caregiver, he's a young child, and they are using very simple toys. As I said, we can start with basic toys, with anything they want, even a paper, a pen, a puzzle, anything. Yeah.
Joanne, I'm just interrupting you to ask you if you can speak a bit slower.
Yes, sure.
Because I think the interpreters will struggle.
Okay.
But yeah,
okay.
Thank you.
Thank you for letting me know. Okay, so this is like a play therapy session where the psychologist is meeting up with the child and with the caregiver and doing the session together. These are some photos of the working with Beirut blast survivor. I don't know if everyone knows, but we also in Lebanon are victim of war, victim of explosion, of torture. So we are, personally, I'm a secondary victim of torture and maybe of war, if I can say, and also a primary, because we lived the war of our parents. We know what happened, and also we lived the explosion. So we can see the psychologists working on the field with the children. Here are some photos as well. The psychosocial support, the community-based psychosocial support sessions who are conducted at Restart. As you can see, these are groups of children with psychologists, and they are doing several activities. As I said, what is very crucial and what is very specific for children is that we need to be creative all the time. And very important, we may use any simple object to promote like the communication with the child. So these are also other photos of group activities with children. As you may see, they will be drawing, painting, dancing, anything they would like to do. And this is a photo of the family therapy session, where you can see that the psychologist is meeting with the family. You see a lot of members because every beneficiary is supported by his psychologist. And this is really a very important moment. We share some food, some juice, because this will really enhance like the communication between the family members, and like everyone would be feeling comfortable in this space. This is also like a birthday for a beneficiary. She's a victim of war. She used to say, I have no birthday because we cannot afford one. So it was a very emotional moment because we did the birthday for this little girl at the center with her family. So now, since we talked about the modalities, I want to talk a bit about the approach that we use. But before starting with the approaches, I just want to go back again to the relationship and to the space and to the frame of the therapy, because it's crucial. The therapies are also very important to support and to give techniques for our work. So there are several approaches. The play therapy, it could be any type of play. The cognitive behavioral therapy, the common element transdiagnostic approach, when we do like trauma processing and we work on coping skills and on parenting skills, the eye movement desensitization and reprocessing, the narrative exposure therapy, psychoeducation. We do a lot of psychoeducation and parental guidance session for the parents. And what we also have very special and unique at Restart is that we have non-psychological services, like physical therapy, speech therapy, psychomotor, or what we call also occupational therapy and special education. So why I'm saying this is very important, because as you will see later on in the slide, these psychological services, they will contribute a lot to the child psychological development and to the progress of the therapy. So I wanted to share some photos as well before like talking about some numbers later on. These are drawings done by children who are followed at Restart. And I wanted to share some quotes because I found that this is really very touching, and we need to hear this because this will give us the motivation and the will to help these children. When we hear what they are going through, when we see their drawings, we can visualize more what happened with them. So one like 15-year-old boy said, I'm in that cage and my life is limited by this bar. I'm nothing, I'm no one. If I got sick and died right now, no one would know about me. And the last one, when people curse you, me and my family, I tell them, may God forgive you. I refuse to show you any hate. So these are, as I said, drawings and paintings done by beneficiaries who were followed at Restart. I would like to go very briefly about the objective, since we talked about the therapies. So, and I think everyone knows that the objective that we work on are to reduce the symptoms of the torture, especially symptoms of PTSD, depression, anxiety, to process the trauma, to increase the coping strategies, to restore the body image and reduce the somatic discomfort, to help the child gain self-esteem, because we know that torture is very destructive to self-esteem, to the self-confidence, and the main aim of the torture is really to humiliate and to destruct the personality. So it's very important to work on the self-esteem. We work a lot on overcoming the consequences of the cognitive distortion. So the cognitive distortion that followed the torture. I'm a bad person. I'm a bad child. It's my fault. I deserve what happened. Work also on developing a feeling of belonging, acceptance, and safety, on reaching developmental milestones, because it will as well increase the self-confidence and the adaptation of the child in school and in the community. And we work on facilitating social integration. So after introducing and telling you about the different, I would like to show you just few numbers about the benefits of the therapy and the approach, the holistic approach that we use at Restart. As I mentioned before, what we do at Restart is not only psychological assessment or psychotherapy with the children. We have a holistic approach. I will be talking about it more. So the number of children treated from 2022 till date, 3,236 children, receiving 37,352 sessions. The average number of sessions per child is around 12 sessions. So as I said, holistic approach is because the team is very big and the team is very specialized and very diverse. So we have the psychological treatment, we have the speech therapy, special education, the psychomotor, the neurological also follow-up. We have a neurologist, psychiatrist, pediatric, physiotherapist, and animation session. Because we believe that we need all of these specialties to help the child overcome his trauma. So the distribution session is between face-to-face session and remote sessions. As you can see, face-to-face sessions are larger and than the remote session, but we want also as many children as we can to benefit from the therapy. So we want to reach them wherever they are. So that's why we do remote session, and this started during the COVID. So on this chart, very briefly, as you may see, this is a comparison between the result of on the pre-test and the post-test that we do with children. So the pre-test is the psychological test that we do at the first session or during the first sessions, and the post-test is the same test that we will use to assess the same symptoms by the end of the therapy. So as you can see here, it's a significant progress and a difference between the pre and the post-test, and we can see children will develop their self-esteem. They will reduce their thoughts of ending their life, the self-blame, the sadness, the fearfulness, and the anxiety. I will, okay. So as I said before, from our experiences, we know that non-psychological services are also very important. As you may see here, this is the speech therapy services chart. We see that speech therapy is not only working about the language, and our objective is not only to develop the language. It's very important to help the child speak better or reach like the normal capacity of speaking of his age. But what we also noted is that speech therapy would increase as well the confidence, the cooperation of the child, showed that children were less nervous, less impulsive, less moody. As for the special education services, as we said, children need to be integrated in the society. They need to communicate with other children. They need to go to school to feel that they belong to a group of people and they are doing something like important in their life and they are benefiting from the education. That's why we provide as well special education service. But what is also surprising is that the result of the assessments prior and after the therapy showed that also psychological traits were very affected by the special education services. So as you see on this chart, in addition to the language, to the mathematics, we see that the children became more sociable, interactive, attentive, confident. They are less impulsive and less agitated, in addition to other benefits on the psychological level. As for the psychomotor levels, when it's all related to the child capacity of feeling confident in his body, restoring his body image, being more attentive, and moving in the space in a much, I would not say easy, but comfortable and confident. So as well, the psychomotor therapy helped a lot the children to feel better in their body schema, on their coordination, on their capacity to function better as well at school. So although we talked about the benefits, about the modalities, we cannot continue, or we cannot ignore the challenges that we face as well in working with children who are primary or secondary victim of torture. Some of the challenges that we face is the lack of awareness on mental health among the society, in the communities and in the school. This is something that we are working on a lot at Restart, on a community level, on a national level as well, because we know that when we raise the awareness, we will be able to identify more the children who are victims of torture and help them better. And also it will reduce the stigmatization that children have and the family have on mental health. And people will seek more treatment, and they will for the psychological follow-up and for increase on developing their mental health. So so that's why we are increasing the training. We have people from the community who receive training and Restart, and who are able after several sessions to identify basic signs in their community, and they will be referring children to the center. And we have a lot of connection with other NGOs and other partners on national and international level. Another challenge is the commitment. Some of the time, most of the time, or very frequently, we find that people will start, or even children will come to one session and will not be able to continue, sometimes because the parents are not really aware of the importance of the mental health. Sometimes it's related to other challenges and barriers that are not internal but external, like the transportation fees, like the distance from the center, many other socioeconomic challenges and problems the parents are having. Even if we have a very big, a very diverse team with really a very big number of psychologists and specialists, we also still lack resources on human and material level. Human, we need more clinicians because we really have big number of children, and we need everyone to be specialized and working with children. And for sure, it's always like a challenge to have the fund to serve these children and their families. So as I mentioned before, the lack of family and social support is a big challenge. We are working on reducing it and overcoming it, but it's still a challenge at present. The absence of basic needs, so the social and economic situation affects a lot. And we all know that if children are not receiving and eating and sleeping and being in a workplace, safe space, they will not be able to benefit from therapy, and we will not be able to provide therapy for them. The safety concerns and the continuous threat that the families are facing, and the continuous and repetitive trauma. So to end today, we'll say that we are all here because we all want to talk about torture. We want to help people who are tortured, and we will not remain silent for this torture. So I would like to thank you all for listening. And I want to add that how we can also talk about torture and raise the voice is by advocating for torture, by doing these seminars, by advocating, by changing laws, by working on national level to reduce the stigmatization, to raise awareness among the society, among the internal forces, the police officers, among everyone who is working with the community. And this is a very important work that we do at Restart. And I think as clinicians also, this is our role to advocate for stopping the torture and changing the laws. Thank you very much for listening.
Thank you so much, Joelle, for your excellent presentation. And
thank you.
And also addressing some of the challenges. I think the key, some of these challenges I can I can see also from often when we speak. I'm now going to refer to the global standards. I don't know how familiar you're all with them, but there's one of them that clearly focuses or emphasizes that we should be also providing treatment to families and children. And most of our of the IRCT centers, they refer to the similar challenges that you've been pointing out here. Yes. But yeah, thank you so much, Joel. I'm not sure if
Thank you.
anyone from the audience has any reflection, comment, question.
Yes, but before I leave,
Go ahead, Khalida.
yeah,
Yes.
first of all, it was a great presentation, and
Thank you.
I found so many similarities, especially the challenges are almost the same, but I just would like to share the situation in Pakistan. Do have children who are direct victims of torture, who are picked up from the streets and put put them behind bars, and then they experience torture. And another form of torture which is very taboo subject till today, and our organization has been working on it. It's sexual abuse.
Yeah.
Sexual abuse, and yeah, it's still a very taboo subject, but we have worked a lot. And I would also like to share that tools we have been using for terms children is mime theater or theater. So when we say mime theater, the children express with the sign language their issues, and they perform theater. And then they question audience that is it acceptable to go through such experience. And you see, and theater we do use. It's really excellent presentation, and it's right time to share our experiences and join hand and work together. Thank you very much, Restart and Beta and IRCT. I congratulate, and I have to rush, and I have to give a presentation to an ambassador to Scandinavian country, one of them.
Good.
So,
Good. Go ahead, Khalida.
And the special area of concern is children today. So, it is a value-added participation from my side. Thank you so very much. Okay,
Thank you, Khalida.
then now Nida
Thank you,
is there.
Khalida.
Welcome. Nida is there to represent
continue.
us. Yeah.
Good.
Okay, bye.
Thank you.
Thank
Keep
you,
up great
Khalida.
work. Keep up great work. Okay,
Yes.
bye.
You too.
You too,
Bye.
Khalida.
Thank you.
I'm not sure if anyone else has similar reflections, also in line. KRCT, go ahead. Violka, do I say your name correct? Yes.
Yes. Hello, everyone, and thank you for this opportunity to to take part on this important topic, exploring all the symptoms and intervention plans for children who have gone through hardship, through atrocities and torture. I'm part of KRCT, and I'm the manager of a project which supports we offer psychosocial support for women and girls who have who are repatriated to Kosovo, and also the ones who are refugees or under state protection. So these women are often mothers of children, and we also, in a direct way, sometimes indirectly, by supporting the mother, we support the children as well, because when the mother's well-being is so important for the well-being of the children. So even if not directly related to my work in this project, I'm part of KRCT, and we work a lot with people who have undergone torture. I'm a psychologist also. My interest is very much on the sensitivity of the child-parent relationship. In cases when we support children, of course, you presented the family systems therapy and also the group therapy and community service, but I'm just wondering sometimes, and also maybe reflecting, and also in a form of question, Very often the children, even if they are not feeling safe, because we talked about safety of children, but sometimes their very own home is not the safe space.
Exactly.
And that could be problematic because children have these mixed feelings. Sometimes they are scared to lose that parent, even if they are not treated very well. These are the caregivers, and somewhere between the lines, they might feel the love because the parents are giving them mixed feelings. One way they are not treating them well, but there are cases when they are offering them love and support. And how to handle this situation at best, how to help the children overcome that fear and that feeling of guilt when they are speaking about their own parents, and conveying information which puts their parents in a very bad position as these so-called perpetrators or monsters, and the child has all these mixed feelings in relation to the parent or caregiver.
Okay, thank you, Violka, I think your name, for your intervention and for this very important reflection. So we're talking and I was thinking at the same time how to handle the situation. So I will just very briefly answer from our experience, and I hope this could help you. So at Restart, we also work with children who are victim of abuse, from like sometimes the abuser is a person in the family or around the family, and sometimes they are seeing their parents or their mother being beaten or abused, etc. So this is a very challenging situation. What we do at the beginning is we try to see the child alone, as I said, and to explain a lot about the importance of confidentiality and that being non-judgmental. And this is the safe place. And what we hear from children, they say, this is the only place where I can talk very freely and be honest and whatever I think. So now when I will leave, I will go back to that place, but no, there are some people who are supporting them. So even if we are providing a minimal support, we're not able to do a lot. This minimal support is very important for the child. This time when he comes to the center and when he's with a psychologist and he feels that he can be reflecting what is going through in the session, and there's someone who is understanding, who is empathizing, and who is trying to help, and just to be able to vent and to process what is going on is very important. This is one. The second thing is when we try to work on what we say, the safety for the interpersonal violence. And most of the time we do this with the caregiver, especially like if the mother is coming to the center and is willing to help the child, we do like a safety plan for the child's safety. Because as you said, Violka, the child, we need to protect him. He's the first person, he's weak, he's the innocent one, and our duty is to protect the child at the first place. And we do like a safety plan, how to keep the child safe when these problems happen, or from this abuse, or from this domestic violence. And the mother is usually the main person who will be applying this interpersonal safety plan with the child. And we communicate with other partners, because we have some partners who are case management for the children violence or the abuse, and we will refer the child for the protection. We coordinate with other partners, with UNHCR, who will be helping on like legally working on the case with the child. But as I said, being at the center, even if we're not doing a lot, we would wish to save all the children and to be of a very good benefit for everyone. Even what we are doing from our experience is something that is very valued for the child.
Thank you so much, because that's for me is the position, the most difficult position, when the abuse or maltreatment or neglect is happening at home, and the child knows that place, even though it's unsafe. That's the only safe place for the child, even if it's unsafe considered by us. So the child can be terrified that the parent, they can be separated by the parent because they love the parent, even if the parent is
Exactly.
not doing a great job at taking care of the child. So
Exactly.
I think that's a very delicate situation, how to protect their children from their own home without them feeling, without causing another trauma of separation. Because if you
Yeah.
go legally, then you have to remove the child from that space, of
Exactly.
course.
Definitely.
Yeah.
Thank you.
Thank you for your intervention.
Yeah, thank you so much for this interaction. I'm just mindful of the time, so I think we should move to the next speakers, Eugenia and Jane from Tree of Life, Zimbabwe. I don't know if you're up. You're already sharing your screen. That was fast. I'm gonna ask you to unmute here. And I don't know, Eugenia, if you could make it full screen. You could make
Yes,
your
I will make
presentation.
it. We'll make it full screen.
I think it's actually in the arrow what you see below on the top right, sorry, bottom right. Perfect.
That's okay, isn't it?
You got it.
Good. So, greetings. Of course, it's morning to some of us, afternoon, evening. Yes, so greetings from Zimbabwe. And Beta has introduced us. There's no need to reintroduce ourselves. And to begin with, we would really like to express our gratitude to Catholic Relief Services for spearheading this process of course, developing and piloting Singing to the Lions. We also would like to thank our organization, Tree of Life, for giving us the opportunity to contribute to Singing to the Lions. So I am with my colleague here. We'll move on to the next slide. Just to give you a very quick background of Singing to the Lions, which started with research that was undertaken in Zimbabwe. We often talk about it started here in Zimbabwe, and developed by a colleague, Dr. Jonathan Brakash, with Lucy Staines, who is with CRS. We were involved in piloting the program in Zimbabwe with Jane Chidzungu Mashonyika, who is with me here, and Lightwell Mpofu, a colleague who is not here today. Singing to the Lions was then piloted in Uganda and then later in Sierra Leone. We will speak more about the pilot in the coming slides. And just to quickly mention that to date, Singing to the Lions tool is being implemented in over 25 countries and has been translated into 13 languages, which is a huge, huge success. Singing to the Lions really does not need expensive materials, expensive venues. It relies on the basic that can be available within the community. It uses games, art, drama, calming techniques, and songs that are mostly local because it is facilitated by locally trained facilitators who are encouraged to adapt the process or the methodology into their cultural context. So there is a picture here showing the people that I've spoken about. After piloting Singing to the Lions, you can see there my colleagues, Jane, Jonathan, Lightwell, myself, and Lucy, celebrating the achievements. Over to you, Jane.
Thank you, Eugenia. Looking at Singing to the Lions in Zimbabwe and the timelines, it was piloted in 2016 in 2 communities, a rural community with older children and an urban community in Harare. And this was after the pre-election political violence in 2008. We also trained teachers, 24 teachers from 12 schools, which are part of the Catholic Education Commission Archdiocese of Harare in 2017. Between 2017 and 2018, it was amplified Singing to the Lion process with children in Luveve, Bulawayo, one of the cities in Zimbabwe, in the southern part of the country. And facilitators were trained in Harare, Gweru, Bulawayo, as part of the Pathway project in 2018. And in response to Cyclone Idai, where lots of children experienced loss and great trauma, children, about 1,222 children were trained in 2019 in the eastern part of the country where this happened. And in between 2022 and 2023, True of Life also, in response to COVID-19, trained children in Matobo and Cholocho. And currently, we are training internally displaced survivors of Cyclone Idai in the eastern part of the country. And note, it is also being used in many different countries during this time span, the Middle East, parts of Africa, and Southern Sudan. And here we are seeing children participating in a group discussion with the facilitator. Like what Eugenia said, we don't need fancy places. The facilitator and the children are having their discussion in one of the gardens. And who is it for? It is primarily for children and youth with ages between 11 and 25 who are experiencing or have experienced violence and torture in their lives. So these children are living with serious trauma. It can also be used for children as young as 8 years of age with some modifications. So they need lots of support. And the violence and the torture can take the form of physical, emotional, and psychological form. Examples being child labor, domestic violence, early marriages, sexual abuse, bullying, stigma, loss of parents through death or through divorce, forced migration, internal displacement, and of course, the political violence I have mentioned before. And these children are mostly primary or secondary survivors of violence and torture. And there we are seeing a group of children aged between 11 to 14 years reflecting on a tree before drawing their own trees. We'll come to that in detail later when we explain the themes. Singing to the Lions methodology. Singing to the Lions is a participatory methodology tool to help affected children and young adults to overcome fear and violence in their lives. We use allegory, games, and art to overcome their trauma. It relies on evidence-based methodologies related to psychosocial resilience, cognitive psychology, and narrative therapy. Of course, you'll be hearing about this as we move on. Over to you, Eugenia.
So thank you so much, Jane. And we move on to the implementation. Implementation of Singing to the Lions is done in three main parts. So we start with the pre-workshop part or component. And just to mention that all these three are very important to the impact. So during the pre-workshop period, there are meetings that are held with a number of people in the community, the leaders, the government officials, the stakeholders, other organizations that are working in that particular community. And we also include members of local child protection committees, where Singing to the Lions methodology is introduced as a concept. There are also meetings that are held with the parents or guardians of the participating children to explain what Singing to the Lions is all about, and to also obtain consent from the parents and assent from the children. And during this period, the children also complete a pre-workshop assessment form. And of course, we come to the actual workshop, which can be held with groups of about 20 participants. We've worked with sometimes 25 participants, but it's always good to keep the group as small as possible so that the children can benefit, and you can also attend to the children in the workshop as individuals. And for these workshops, you always have two facilitators that will be working with the children, so that in case a child breaks down during the workshop, one of the facilitators can continue with the workshop while the other facilitator attends to the child. So there is flexibility in terms of how the workshop is held. You can do it in a 3-day event, or you can also have it as 3 one-day workshop on weekends. And of course, this will allow the children who are in school to attend during the weekends. And also, it gives them time in between to practice what they've learned. Or it can actually be done through 6 separate modular sessions of 3 hours each, for example, once per week. So this flexibility allows as many children as possible to attend and benefit from the workshop. After the workshop, the children will actually complete the post-workshop assessment form that will also be done after 3 months on follow-up. So post-workshop, this is also equally important, like I mentioned earlier on. So we have the children that have participated during the workshop going back to the community, going back to their school, and sharing with other children about what they've learned. And this, during this period, other children get interested and would also want to participate. But the community also really begin to gain interest in terms of what has been happening to the children, and can also support. There are ongoing group meetings that happen post-workshop, and these are also key. They are in 2 forms. They are action groups to implement the actions that have come up during the workshop, so that the children can actually follow through the actions that have come during the workshop that they've shared with the other schoolmates and the community. And then with another group of skills group upgrade, where the children will apply the skills learned, will practice what they've learned, and they will share experiences in terms of what has been working, what has not been working, what can they do better, and they support each other in this process. So just to mention that this post-workshop group program aim to improve the lives of the children. And if in case adults have also gone through, they will also benefit. And they actually make Singing to the Lions more effective. So it's not just the workshop, it's not a once-off thing, but we also have these post-workshop activities happening at community level and engaging more and more children. And we move on to the focus of the workshop. So the workshop has three main focus to help participants lessen their anxiety and fear, while also helping to increase their self-esteem. This is so useful because quite often children who have been affected with trauma will have very low self-esteem. It also teaches participants how they can control the way they respond to fear so that it doesn't overwhelm them in the future. So this empowers them and gives them the control. So they're very interesting exercises that children do, very interesting games that they will also do that help them to be able to control the way they respond to fear, the way they respond to violence, so that they are not overwhelmed. And lastly, Singing to the Lions teaches problem-solving skills, and it also promotes efficacy. The children learn from the activities that they do during the workshop, and even during post-workshop, they actually learn to problem solve, and they learn from each other, they support each other as well. So referrals for one-on-one support are provided internally within the workshop, or sometimes they are referred to other specialist services. Over to Jane for the themes.
Yes, thank you so much, Eugenia. Coming to the themes, the Singing to the Lion process is composed of 6 themes or 6 modules. The first one being the welcome. The welcome activity is done in a very vibrant way, filled with fun, where there is singing, dancing to music, games, and a little bit of drama. And children in this welcoming session, they face their lions metaphorically. Sorry, they face their fears metaphorically in the form of lions. Instead of them being intimidated by these lions, they sing louder and louder and louder to create a wall of sound that overwhelms the ferocity of the lions. Then the second session is about discovering who we are. And this is a very important session which takes quite a lot of time. And the session is to help or to give children an identity and vision for their lives, where they liken their lives to the life of a tree. It has 4 sessions, which involve acting, drawing, discussion, and walking. The acting part, they act being trees, showing the roots, the trunk, the leaves, the branches, as shown in that tree. Then the drawing part, each child is given a full sheet of a flip chart paper where they draw their individual trees, showing the roots, where they come from, the trunk, which shows the good times in their lives, the bad times as well in their lives, branches, which shows their hopes and wishes, the leaves, which shows their talents, skills, and achievements, the fruits, showing what is good in their lives currently, what is good in their lives right now. Then they also add the harmful insects. What is it that stops them from achieving their hopes? And the discussion part, after drawing their trees, they sit in twos and share their stories, where they listen to each other attentively without judging each other at all. And after that group discussion, the pair discussion, each child hangs up his or her tree on the wall, close to each other. Then they do a gallery walk where they look at each other's trees, and also seeing how trees are strong when they are together, seeing the strength of the forests. When individuals come together, they become strong. They also learn to be strong as groups. So just creating that culture of working together with other children to gain strength. Then the third theme is understanding fear and violence. And of course, in this session, we are helping the children to understand the nature of violence and its impact, and also what fear does to us. And of course, they also learn alternative ways of responding to fear and violence, that is, responding in a non-violent way. And this helps to break cycles of violence. They will be learning about that in the process of these activities. Then the fourth theme is strengthening who we are. We have so many activities in this process. So it's like the children will learn to have a positive view of themselves, irrespective of what is happening around them. And there are so many activities in this theme, which teaches children the skills of looking at themselves positively, like the treasure tree. The activity explains that, of course, the tree is a metaphor. So it's also explaining that within each child, there is something within that child which no one can take. And it's explained as a visualization exercise. And it produces very good results. We have had so many testimonies after that activity, which we'll share later on. Then in the other picture, we are seeing that young lady sitting quietly. It's called changing the channel. So you don't have to remain the same when things are not going on well. You can always change the channel to reduce the negative impacts within yourself. And making connections is the fifth theme. In this, they look at the dangerous and safe places as a way of helping take charge of things which are around them, to help them change the negative things which are happening in their communities. So they identify the safe and dangerous places with the hope of helping the elders, the parents, aware of what is happening about them, and also later on helping the parents come up with actions to take to help the children deal with these issues. And of course, when they also make connections, they also do quite a number of games, like the run game. The games which they play all the time, they activate that. And they also do the honoring process, which is a very powerful document for each of the child, because most often these children who are living with trauma have never been appreciated. They've never received a positive comment. So when children write, each child writes a comment at the back of each child, and when they've completed the writing, they read what the other children who have written on their backs, and it gives them a sense of hope. It gives them a sense of worthy. So a powerful document for each of the children as they move forward. Then moving forward, the children look at their problems. What is it that they can do? They identify the small steps they can take to overcome their fears of powerlessness. And this activity helps the children to realize that they can solve their problems in small ways instead of being overwhelmed by big problems. So each step they take is very helpful in moving towards solving their challenges. And children really love this. And of course, the facilitator draws a big mountain, or you can ask the children to draw a big mountain, and they talk about the small steps they can start taking to overcome their powerlessness. And they also write messages to friends all over the world, in
Eugenia,
their communities. Yes.
sorry that I'm interrupting, but I think we're not getting the right presentation. You're still in the slide of 6 themes modules. Maybe that's the correct one.
Yes.
That's the correct one. Okay.
Yes,
Okay.
it's the correct one.
Okay.
Jane is
Perfect.
on moving forward. Thank you so
Perfect.
much, Beta. Thank you.
Yes. So I've just finished with the moving forward. Mm.
So thank you so much, Jane. And of course, we want to quickly look at the areas of knowledge and skills that are contained in the Singing to the Lions. There are 6, and of course, the learning techniques of self-calming are very important. These techniques are very important. They include breathing. The children learn to breathe and realize that they are actually in control. When they have fear or they are under threat, they can actually breathe and nobody can stop them from doing that. The movement, the meditation, all this enables children to make rapid and effective decisions based on reasoning rather than fear. Children also learn knowledge and skills on how they can alter negative view of themselves as the one deserving. There are games talking about, is it my fault or is it not my fault? So they learn and realize that, yes, in areas where it's their fault, they take responsibility and look at the lesson learned. But they mustn't take responsibility of things that have happened because of other people's faults. So this is very, very important. They also discover their strengths and their attributes in this case, and that makes them stronger. They learn how to decrease social isolation by getting connected, or sense of stigma. There's a lot of knowledge, and they also practice doing it. Understanding the impact of fear and violence on their lives, and they also learn to identify resources that are internal within them, okay? And they also look at the resources that are external around them, okay? So they also have an exercise where they can go when they have problems. So they're identifying external resources, and in the process, post-workshop, they will work towards strengthening some of these external resources. And then they learn how to identify ways of overcoming violence and fear in their lives. And we mentioned earlier on about this, and analyzing problems and implementing plans of action. And this continues after the workshops. Yes, the exercises and the knowledge they gain helps to give them hope and goals for the future, which is very important in a country like Zimbabwe, where a lot of children have lost hope. The young people are unemployed. They have nothing to do. And those that have lost hope will resort to drug and substance abuse or other destructive ways of coping. And then Jane?
Yes, thank you, Eugenia. And of course, what contributes to the success of the methodology or the involvement of parents and guardians who are very instrumental in the healing process of the children is very helpful. Inclusion of local leaders and community members, investment in preparation and post-workshop activities, and it also promotes the bonding and bridging, the binding where the children develop maybe the skills, their inner resources, which they will have lost as a result of the trauma. They resuscitate them and use them. The bonding, they connect with other children, other friends within their homes, within their schools. The bridging, they know where to go to in times of crisis. They know who to report to when faced with a situation. And of course, this all comes after the activities which we have mentioned earlier on. And training of local facilitators who stay within the community, who know the children, and it's also adaptable to the cultural context, and it is applicable to a variety of situations. And we've got cases after children have gone through those processes. We had one young girl who was an albino who felt she was always stigmatized. After the workshop and after the treasure tree, she expressed that she no longer cares what people say about her, because she knows she has something which is very important inside her, which no one can take. And we also had a grandmother who testified that her grandson used to bedwet. He was naughty. It was difficult to send him. He would not come back. But after the workshop, he's a changed person. And some other children always testify that I am getting the positive comment the first time. I'm really happy. And after visiting the forest, they talk of, I thought I was the only one. who are suffering, I realize we are so many and we are a big forest. If we come together, we can live happily. So those are just a few of some of the cases we hear from children.
Thank you so much, Jane. And quite a lot of the challenges that were shared by Joel are very similar to the challenges that we face as well, working with children, using the Singing to the Lions methodology. So working with children who cannot read and write can be a huge challenge. You find in Zimbabwe sometimes some of the children could be 14, but they've never been to school. And of course, we mentioned earlier on that we can adapt and we can tailor-make so that we can work with these children, but it's not always easy. And so, yes, we have quite a number of cases in disadvantaged communities, like one case in a peri-urban community where one girl actually went into commercial sex work because she had dropped out of school. She also told us and asked us, where were you? If you guys had come to me 2 years ago, I would be somebody different. So yes, it's not easy to work with children or young adults who cannot read and write, who are illiterate. So sustaining the post-workshop groups for at least 1 year is not easy. Given our current context and also the socio-economic and political factors. So for the Singing to the Lions workshops to be very effective, those post-workshop groups should actually be running for at least 1 year. And having those continue for that period can be a bit challenging because of instability in the community and also the distances that the children have to walk in order to go and participate. And sometimes the resources that are needed in order to ensure that the children have something to eat. We also have challenges, as I mentioned, the socio-economic factors, yes, political factors as well. Organized violence and torture in Zimbabwe is ongoing. And every election year actually brings in more of the organized violence and torture. And so, yes, after the children are sort of coping better, it comes back again. But if those groups are there and they are sustained over a long period of time, then it will help create safety within that community. Lack of awareness, yes, on the communities that we are working on. Awareness in terms of psychosocial support, the needs of the children, children's rights can also be a challenge. It then means having to layer our activities with some of the work that is done by Tree of Life so that we create awareness, and then we can then come in with Singing to the Lions. So those are some of the challenges in brief. And just to mention that, there's also a lot of progress that has been made regarding Singing to the Lions. Of course, we do have the pre-assessments, the post-assessments, and the assessments that are done after 3 months. And all those have actually shown huge positive impact. There is need to do more research. And we are very excited that there will be a 2-year research project to evaluate the impact that will be done in Zimbabwe. And this will give us a lot of information regarding Singing to the Lions. And the model will also be evidence-based, which is really very important. So Singing to the Lions materials are there online, and people can actually access the materials. we encourage people to communicate with the senior trainers, to communicate with Jonathan, Lucy, CRS, in order to actually get more information. So you will see the link at the bottom. And of course, we have also written a chapter in a book that was published by Routledge Press on psychological interventions from 6 continents, culture, collaboration, and community. And Singing to the Lions, culturally relevant intervention in Zimbabwe and beyond is on chapter 10. So we encourage you to grab the book and get more information. And thank you so much for listening and for your presence. Questions are most welcome. And there is a link there at the bottom. Thank you so much. And over to you, Beth.
Yeah, thank you so much, Eugenia and Jane. I already shared the link in the chat for our colleagues if they want to access the material, but also to remind them that we will be sharing the material, not only the presentations, but also these tools that you're sharing in the FABO e-learning site. But yeah, it's interesting that it's that it's translated into 13 languages already. That's quite a success, I would say. Yeah, and exciting that it's going to be the evaluation is coming up, right? This 2-year research project that you're mentioning. Yeah, we would like to follow that up closely. Yeah, but anyway, I'm willing to see if anyone has comments, reflections, reactions on this wonderful tool that Tree of Life has shared with us.
Yeah,
I know we're. Hi, Muhammad. Go ahead.
Thank you so much, Berta. I really appreciate Jewel, Eugenia, Jane for their nice presentation. As most of the colleagues at the session know, that Human Development Organization is working in the prison environment of Pakistan for the last over 15 years. We have seen that there are always children either accompanying their mothers, those who are below 10 years of age, and others are about 12 to 18 years. My question, I just want to talk about those who are the children accompanying their mother in the prison, who remain exposed to the double trauma, like seeing their mothers arrested and later landed in the police station and suffering from psychological or physical torture. They are suffering from double type of trauma. We have what we have noticed, and the case study shows that one is that during the arrest of their mothers, and later while landing in the prison. Where we have seen those accompanying children developing some negative behaviors like irritability and negative behavior, stubbornness, like that, lack of cooperation with the caregivers. The second is the hyper arousal, and the most disturbing behaviors is for the caregivers of the ITU is they are found engaged in some negative activities like using abusive behaviors, abusive language, and imitating the immoral activities of their mothers. I just want to seek the guidance from the honorable presenters. Please guide us what kind of therapy would be most effective in an environment of prison where we are facing high restrictions and the children are exposed to difficult situations. Thank you.
Thank you, Mohammed. I don't know if Eugenia, Jane, or Joel have have a reflection on this that Mohammed shared. Mpande.
So thank you so much, Mohammed. And yes, Beta. We mentioned earlier on that singing to the lions can be used in different contexts. And I think, yes, it will be applicable and can actually be used with this kind of children. And of course, maybe it also needs to be used together with other interventions. Yes, how can we engage the parents? How do we engage the mothers? And also looking at their context to see if it is possible to actually have the post-workshop sessions that will support the workshop itself. There is need to do a lot of preparatory work to prepare for the Singing to the Lions workshop. And I think if all this is done within that context and supported, it should work. Do you have anything to add?
I think you've said it well, Eugenia, unless we need more clarity.
Yeah. Thank you so much, Eugenia and Jane. Joel, I can see you're moving towards the mic.
So thank you, Muhammad, for your feedback and for your question. So as I understood, you would like to know more about how we can help children who are in prison. This is what I got from what you were expressing. So according just to our experience, for sure, working with children in prison is as well very challenging. One of the most known therapy that works, and it's like as well in the research, is when doing like as well psychodrama with the children and like acting out what happened, bringing them together and like just role playing and doing psychodrama. We have people who started doing this in Lebanon and the prisons with adults, and we're hoping that this will also be with the adolescents, because it showed that it was really very effective doing psychodrama with people in the prison. Another thing I was just had in my mind, like somatic based therapies show to be very effective as well. So everything related to the breathing, the mindfulness, the relaxation, and just to reconnect with the inner self and with the body, because it will restore like self-image and reduce also the pain and the somatic symptoms, because we know that in the prison sometimes we have like some behaviors that are not very respectful to the identity of the child. So work on the body of the child with through different somatic based technique and therapy, and this is something that's very promising, would be efficient. Honestly, I would think more about it, so maybe we can discuss further more, but these are the two thoughts that came up to my mind when hearing your question.
Thank you so much, Joel. I'm mindful of the time, but I also can see that Kanayo has been having her hand up for some time. So Kanayo, we can briefly address your question and then we'll have to leave it here.
Okay, thank you very much to all the speakers. My question is to Eugenia, because looking at the slides and listening to them, I think that Zimbabwe sort of has the same perennial issues that Nigeria has. Now, we've had to, how do you deal with children? We've talked about children who have to go back to the homes that are not safe. And with the lack of social care in Nigeria, it's sort of a problem knowing that you're essentially releasing the children back to, an unsafe space. But that's not my question. My question is, how do you deal with a situation when you have children come in and essentially they are starving? They're not even able to say anything to you until maybe you feed them. There's only so much you can do with limited resources. And sometimes we find that, the therapists are so empathic, they have so much empathy that they're feeding the children with their own, from their own pockets. But it becomes difficult a child doesn't want to talk about therapy. He doesn't care what you know until he knows that you care. And what's important to a child who's starving is they want to eat. So how do you deal with those situations? And if you do, how do you deal with that if you deal with it in large numbers, essentially? Thank you.
Yes, thank you, Kanayo. Yes, we do have the same situation in Zimbabwe. And of course, I mentioned earlier on about the economic challenges, and what you've mentioned includes some of our experiences. So yes, we do ensure that when children are getting together, there is a bit of something to eat. So yes, we do get well-wishers. We look around for the basic, and we're talking about basic food so that the children can have something to eat, because it will be difficult to work with children who are hungry. So we always ensure that we provide something very basic, something that we can get from the local community. Yeah, sometimes we can boil maize seeds, and we find ways of making them nutritious, adding some pumpkin, and depending on the context, we do provide basic food for the children to eat. And Jane, you can come in.
During the workshop. And of course, like Konai, you are also mentioning that when they go back home,
Yes.
the situation is quite bad. We have the referral systems. If the social welfare is available in the community, those are the children whom we refer to the social welfare. And during the workshops, we also have child care workers who take note of these children and do the appropriate referrals. And of course, we continue checking whether the children have been assisted. But of course, the numbers are too many. It might not be possible to help each and every child, but we try to support the worst situations through the child care workers.
Thank you for your response.
Thank you so much for addressing that. Actually, Kanayo, thank you for bringing on this approach or this angle, I would say, because this is something that obviously we get hinders, right, the whole healing process. But yeah, I'm afraid we went 10 minutes beyond time, so we'll have to close here. But I will thank you all for having joined us today, especially the speakers, Joel, Eugenia, and Jane. And as always, we have a very short poll that my colleague Andrea will launch now. Exactly, now you can see it on screen. It's 3 quick questions on satisfaction survey that we ask you to please fill in before leaving the meeting today, because this helps us improve these spaces. And just to remind you that the next one we will be having is the session on how to work with children and families. So a more specific focus on families. That will be in November. And then in December, we're having the last session of the year on documentation and screening torture on children, where we're going to have colleagues from the Swedish Red Cross. I saw some of them online today, Victor. So yeah, very happy to see you. Thank you all. And please follow up with us. Reach out to us. I will leave my email here in the chat if anything was unaddressed or if you have any questions. But if not,
everyone. Thank you.
Thank you, Eugenia.
Thank you, everyone.
Thank you so much, Joel.
Thank you.
Thank you.
Yeah.
Thank you,
Have a good
Berta.
day.
Bye-bye.
Bye-bye, Muhammad.
Bye.
Thank you so much for joining.
Right.
Thank you.
Thank you.
Bye-bye. Thank you, Andrea. Perfect moderation, facilitation.
Very good.
Good.
Yes.